Hello friends, I am Dr. Vivek Jain, Faculty of Preventive and Social Medicine, that is Community Medicine. I will be discussing the PSM component of the recent NEET-PG 2021 pattern exam questions. Friends, just a bit about the whole exam and PSM subject as a whole. I must tell you that this time overall impression of the students was that exam was easy to moderate. But PSM exam MCQs were quite easy. Lesser one-liners were there this time, but majority of questions were converted into 2 to 3 liner questions even in PSM, giving it a clinical approach type of view. Friends, also remember, many questions were from expected topics and there were quite a few repeats also. There were only 3 questions which were difficult in the sense they were never heard of. The topic was asked for the first time in the exam. Friends, a heartfelt thanks to students of my Dr. Vivek Jain PSM mobile app, students of Facebook group Prep Ladder Premium Club, and students of Instagram group Vivek Jain PSM for helping me reconstruct these NEET-PG pattern questions. Friends, if I have to summarize, overall there were 26 questions from the subject of PSM, 23 were direct PSM questions and 3 were overlapping with the other subjects. So let us start with first question of NEET-PG pattern 2021. From the subject of PSM. Question was, school health is the responsibility of, is it subcenter, PHC, sub-district hospital or district hospital? Friends, school health services were first recommended by Bhor Committee 1946 and finally school health related guidelines were given by Renuka Roy Committee 1961-62. It has been recommended that school health services ideally should be a part of general health services. And when we look at our country, general health services in rural areas is mainly delivered through primary health centers. So school health is also a responsibility of primary health center. In fact, in school vision screening program, when a teacher screens for visual acuity of the child, if required to be referred, is referred to primary health center, paramedic ophthalmic assistant for spectacle formation. Question number 2. There is a history of pharyngitis in a 4-year-old child. Swab was taken and sent for culture. Swab material should be discarded in which biomedical waste management? Friends, as discussed in the biomedical waste video in my mobile video lecture app, we have seen that soiled waste, that is soiled biomedical waste, it includes all the cotton and cloth material which is contaminated with any body fluid like pus or blood. So it will include swabs, gauze pieces. If you do bandaging of a patient daily, then bandage which is removed or dressing which is removed will also go into soiled waste. Beside this, if there are any blood bags in which some blood residue is left, that is also going as a part of soiled waste for disposal. And you tell me, soiled waste is disposed under which biomedical waste category according to the recent guidelines? It is yellow category waste. So answer to this question will be yellow category. So please remember, all the soiled waste like human anatomical waste, animal waste, chemical waste, cytotoxic expired drug waste, liquid waste, bed linen and mattresses, even microbiological and biotechnological waste all go into yellow category, where the major disposal mechanism final is incineration. Question number 3. Which of the following vaccines can be administered to a 10-year-old child who is attending a school? Friends, I am sure all of you know National Immunization Schedule in detail. At 5 years, we give DPT booster. What do we give at 10 years of ages? Yes, tetanus toxoid booster. And under the latest guidelines, it has been proposed that this tetanus toxoid at 10 years of age, 16 years of age, and for girls during pregnancy should be replaced with TD, tetanus diphtheria combination. So answer to this question is choice number C, tetanus toxoid, tetanus diphtheria combination. Besides tetanus, if you are looking at an age of 10 years, please remember 9 months to 15 years of age is also covered under another vaccination campaign, that is MR campaign in our country. Measles Rubella Combination Vaccination Campaign, which is currently delivered in the country through schools, community centers and health facilities. Question number 4. As a trauma patient is brought to an emergency, there is blood spill on the floor. Which disinfectant would you use? Friends, this is a often repeated question asked multiple times previously in the national board examinations. I have discussed this in my app video on biomedical waste management guidelines also. Blood spill should be first neutralized with. It is mainly hypochlorite solution. Suppose there is a large spill or there is a small spill. Then what is the difference? For small spill, use a paper which is moistened with 1% hypochlorite. Use it to wipe the floor. Discard that paper as infected waste and keep on repeating that procedure till the stain is removed. When we look at large spills, it is better to flood the area directly with 10% hypochlorite. After flooding the area, the paper which is used to clean should be removed and disposed of as an infected waste. So answer to this question is choice number B, sodium hypochlorite solution. Question number 5, culture plate is disposed in which biomedical waste bag? Friends, as I told you just a few moments back, when we look at microbiological waste, biotechnological waste and laboratory waste also, all of these are disposed in yellow category as per the latest biomedical waste management guidelines in the country. Blood bags, culture plates, sera, toxins, live attenuated vaccines, laboratory specimens, all are disposed in yellow category. So answer to this question is choice number C, yellow bag. Final disposal mechanism is again incineration. Question number 6. A study conducted in 30,000 women where researcher wants to find out if there is any relationship between C-reactive protein levels and risk of myocardial infarction or stroke. The study subjects were divided into 5 groups of 6,000 subjects each. Relative risk of MI or stroke was plotted against CRP levels. See the image below and interpret the findings. Basically what the examiner is asking, how the relative risk for MI or stroke changes with change in CRP levels. To understand this, let us look at this diagram in a zoom mode. Friends, when you look at HSCRP, that is high sensitivity C-reactive protein level, it is actually a very good biomarker of inflammation that precedes myocardial infarction, sudden cardiac death, peripheral arterial disease, as well as any type of stroke related to that cardiovascular event. So look at these diagrams carefully. Now you can see as the HSCRP level is increasing, the risk of myocardial infarction or the stroke is increasing in both the graphs. So answer to this question is choice number C, increase in HSCRP levels definitely is going to increase the risk of myocardial infarction or stroke. In fact, it has been found in the studies that as far as risk of myocardial infarction and stroke is concerned, high sensitivity C-reactive protein level is a better marker, more sensitive marker than LDL cholesterol. So please remember that. Question number 7. A 55-year-old farmer from the state of Chhattisgarh state, you have to remember, presented with complaints of progressive muscle weakness, stiffness, pain in both the legs. On examination, pure motor paralysis is present. What further history would you take? Friends, this is definitely a case of which disease? Very right, letharism. And letharism is which kind of disease? It is a food adulteration disease. Lathyrus sativus khesri dal is the adulterant which is mixed in commonly used arhar dal, arhar gram or sometimes Bengal gram. This leads to production of a toxin BOA. Beta oxalyl aminoalanine which leads to all the manifestations of letharism. Letharism is of two types, osteoletharism, neuroletharism. Neuroletharism is more common in human beings. Initially there is pain in lumbar region along with stiffness and weakness of the lower extremities, and it is after some time that paresthesia and weakness occur quite extensive. Legs may become spastic and they may exhibit clonic tremor also. Although spastic paraplegia is more common, polyneuropathy or mononeuropathy may also be present. Friends, so look at this question now. What would you like to ask is definitely dietary history. States in the central part of our country, especially Madhya Pradesh, Chhattisgarh, this food adulteration disease letharism is quite common. How do we control it? Ban the crop. Vitamin C prophylaxis may be used. If you have to consume khesri dal, it should be 30% of your maximum out of the total dal consumption. And yes, steeping method, parboiling method also help a lot in controlling this disease. Question number 8. Friends, I got many versions of this question. This is the closest I could arrive at with the help of many students. Students told me the exact question was, brightness of point source of light is measured through which SI unit? Then answer is candela. Let us look at this now. Luminous intensity, which gives you brightness of the source. This is measured through candela. Luminous flux, which tells you the flow of light, this is measured through lumen. Illuminance, which measures amount of total light which is reaching a surface, is measured through lux. And finally, brightness luminance, which tells you the light re-emitted by the surface, the amount of that re-emitted light, this is measured through Lambert. So in this particular question, the question was focused on brightness of the point source of light. That is the total brightness of the source itself or luminous intensity. So answer is candela. Question number 9. For analysis of functioning of a health center with respect to evaluation, which of the following is the most important thing for assessing clinical management? Friends, when we look at evaluation of a health process, it is done in terms of three components. What are these three components? First is structure. Second is process. And the third one is outcome. Let's look at them one by one. First, we look at structure. In structure, we look at if facilities, the manpower, the equipment or the organization, do they meet the given standards or not? In process, we look at diagnostic procedures, treatment, management, care, prevention vis-a-vis as compared with existing standards. In fact, medical and nursing audit is also a part of this. Outcome is measured in terms of improved survival, that is the benefit to the patient in prolonged survival, or if there is reduction of disability, reduced disability. Now let us focus on the language of the question. They are asking which component is most important for assessing clinical management. They are not looking at outcome, clinical management. So answer to this question is choice number C, process. Question number 10. Post flood in Pathan Mitha district of Kerala, fever syndrome is being reported. Health authorities distribute doxycycline drug along with a chemical poison spray. Identify the chemical. Friends, as we discussed in the chapter of disaster management, we are looking at post floods and there is a fever syndrome. An examiner has given you a clue also that we have used doxycycline as prophylaxis. So which disease post disaster are we talking of? Very right, that is leptospirosis, which is generally seen after floods and sometime earthquake. Leptospirosis, a disease which spreads through infected rat's urine. And how do we get as humans? When people wade through or walk through water which is contaminated with this infected rat's urine, one may get leptospirosis. Friends, when we look at exposure, leptospirosis exposure may be high risk exposure. High risk exposure means when people are actually wading through or walking through the contaminated water. This is really a high risk exposure. For prevention of this high risk exposure, we need grade A protection. This grade A protection includes goggles, overalls, boots and rubber gloves. So most effective preventive measure is if you can prevent coming in contact by generally wading through the water bodies or by preventing direct coming in contact with the animal fluids. In comparison to that, when we look at short-term exposures, grade B, then prophylaxis or protection measures are required. Although antibiotic prophylaxis is not routinely recommended, but if it has to be done for grade B, then doxycycline is given 200 mg once a week. This is started 1 to 2 days before the expected exposure and it should continue throughout the exposure period. In leptospirosis control, rodent control is a very important strategy. For this, we prefer zinc phosphide rat poison. Why? Because it has high effectiveness, low cost and its safety record is also quite good. So answer to this question is choice number C, zinc phosphide. Question number 11, acute encephalitis syndrome. This is known as AES in our healthcare system. Cases are being reported from Gorakhpur, Uttar Pradesh, Gorakhpur, Eastern UP. As I have told repeatedly in my video lecture in the mobile app, which disease are we talking of? Very right, this is JE, that is Japanese encephalitis. In fact, there is one more clue given in the question. Read the next sentence. The health team decides for mass vaccination which comes under universal immunization program. That means national immunization schedule has that vaccine also. So definitely we are talking of Japanese encephalitis where we give 2 doses. This is a live attenuated vaccine where we give 0.5 ml each and the route of administration is subcutaneous. Though earlier we were using a killed vaccine, Nakayama strain, but now we are using live vaccine. And what is the strain? The strain is SA14142. This vaccines, 2 doses are given. First is given at the age of 9 months along with measles, vitamin A and pneumococcal conjugate vaccine booster. And second dose is given 16 to 24 months of age along with DPT vaccine booster, OPV booster and measles or MR second dose also. Currently in the country, all Japanese encephalitis cases are reported through acute encephalitis syndrome. So answer to this question is choice number D, live attenuated subcutaneous. In fact, when we look at 2011 to 18 data of Japanese encephalitis cases from Uttar Pradesh, 86% of the total cases of Japanese encephalitis in UP during this time were reported from 4 districts of Gorakhpur division and 3 districts of Basti division. Question number 12. A 16-month-old child has a weight of 8 kg. Look at the growth chart given. Best management will be. Friends, to understand this, let us look at the SAM, Severe Acute Malnutrition Guidelines as given by National Health Mission. All such cases are divided into two groups. First is no SAM. No severe acute malnutrition. Which children are included in this? Mid upper arm circumference more than 115 if weight for height is more than -3 standard deviation, if pedal edema is absent. Such children are classified as no severe acute malnutrition. Then what are the cases included in SAM or severe acute malnutrition? If mid upper arm circumference is less than 115 millimeter or weight for height is less than -3 standard deviation, or there is visible severe wasting, or there is bilateral pedal edema present, then such a child could be a case of SAM, severe acute malnutrition. Now what is the management of these cases? When we look at no SAM cases, in such scenario, the mother is given nutritional counseling, and sent to home. But if it is a case of severe acute malnutrition, then you have to look whether there is no medical complication associated or medical complication associated. In case there is no medical complication, then such a child should be referred to village health and nutrition day or at sub center, and the child should be counseled by ANM, auxiliary nurse midwife. But in case medical complication is present, in this scenario, child has definitely be immediately to be referred to NRC, Nutritional Rehabilitation Center. So I'll again repeat: no severe acute malnutrition, nutritional counsel to mother. If it is a case of SAM, severe acute malnutrition by the criteria given, then you'll see whether medical complication is absent. Absence of medical complication, refer to village health and sanitation day, or you refer the child to sub center where auxiliary nurse midwife will manage the child. But in case any medical complication is present, directly refer the child to NRC, Nutritional Rehabilitation Center. Also friends, if you look at this particular graph, this is the zoom version. Now you can see this is standard line, that is 50th percentile of boys or upper reference curve of WHO, lower reference curve of WHO. This line is -2 SD line, and below this line is -3 SD line. In this growth chart, you can see child lies between -2 to -3 SD. So definitely this is a case of mild to moderate malnutrition. Only if the child is plotted below -3 SD, this red color zone is severe malnutrition. So as you can see in this question, this is definitely a case of mild to moderate malnutrition, yellow zone. So if you go back to the question now, a 16-month-old child has weight of 8 kg. Definitely he is having lesser weight according to his age. And you look at his plot, lies between -2 to -3 SD, that is mild to moderate malnutrition. So it is not a case of severe acute malnutrition. So correct answer to this question would be choice number B. Child is moderately malnourished. Mother should be given nutritional advice. Friends, this was a question topic which was asked for the first time, that is air quality index. In fact, values of air quality index AQI was given for Delhi November month last year. 28th, 21st, 22nd, 23rd, 24th. AQI index was 373, 23, 63, 80 and 470 respectively. Examiner asked what quality of air was reported on 24th November. To understand this, friends, you have to look at the categorization of AQI according to CPCB, Central Pollution Control Board, the agency which is responsible for monitoring air quality in the country. It has divided air quality index into the following categories. Air quality index 0 to 50 represented by green color is considered good. But if it reaches 51 to 100, light green in color, this is called as satisfactory air quality. As air quality deteriorates further, it may become moderate, represented by yellow color when it lies between 101 to 200. 201 to 300 is called as poor. Orange color, light red color is very poor. 301 to 400 and 401 to 500 falls into severe category denoted by red color dark. So friends, in this question they are asking 24th of November 470. This will be dark red color, severe air quality as per the AQI given by Central Pollution Control Board. Friends, also I must tell you, this air quality index is calculated on basis of total of 8 parameters. What are these? Let's look at that. First is particulate matter 10, particulate matter 2.5, sulfur dioxide, nitrogen dioxide, carbon monoxide. Beside this, ozone, ammonia and lead levels, plumbum levels are also included in calculation of air quality index. Then one question came from malnutrition in another form. They asked which of the following is a conditioning factor for malnutrition, which is a man-made disease. Friends, when we look at malnutrition as a disease, what are the ecological factors of malnutrition? Ecological factors for malnutrition are of 4 types. First is food balance sheet. This food balance sheet actually tells us about food consumption. The second ecological factor is socioeconomic factors which may affect or lead to malnutrition. This includes family size, income, occupation, education, and even cultural patterns of food habits and related parameters. Third ecological factor is health care services. This will include primary healthcare services, feeding programs, immunization programs. So this healthcare services will also include educational services. And fourth component is conditioning factors. These conditioning influences include parasitic, bacterial and viral infections that may actually precipitate malnutrition. So answer to this question where conditioning factor was asked is infectious diseases. Question number 15 was a often repeated question. They asked instrument which is used to measure low wind velocity and cooling power. Which is that instrument? Very right. Kata thermometer, earlier used for cooling power of air. Nowadays it is mainly used to assess or measure low air velocity or low wind velocity. Now if you look at instruments which are used in air, dry bulb thermometer, wet bulb thermometer, minimum thermometer, maximum thermometer, 6 is minimum and maximum thermometer, and silvered thermometer. These 6 different types of thermometers are used to measure air temperature. In contrast, when you look at globe thermometer, that is used to measure mean radiant temperature of surroundings. Whereas when you look at wet globe thermometer, that helps you assess or measure environment heat. And it is our Carta thermometer which has a red bulb at the end. This is used to measure low air velocity nowadays, earlier cooling power of air. Then another repeated question, a 34-year-old male presented to OPD with lesion around the neck. Which other manifestation do you expect? Friends, if you look at this particular image, this lesion around neck you can see is pigmented and scaly. Pigmented scaly lesion which occur on exposure to light. We are talking of a particular vitamin deficiency and a particular syndrome. The vitamin is vitamin B3 niacin, and deficiency leads to the syndrome pellagra. And very specifically, this manifestation around neck of a person is known as Cassell's necklace. Now, pellagra is characterized by 4 Ds. What are these 4 Ds? Diarrhea, dermatitis, dementia, and death. So, best possible combination answer to this question is choice number A, diarrhea and dementia. Friend, the NEET-PG 2021 pattern exam this time had another question from the same disease, pellagra. Maize diet consumption is associated with which vitamin deficiency? We are talking of niacin. As discussed in my app video in the mobile in detail, you must have noticed or watched the video where I mentioned that people who use maize as a staple diet. What is the problem with maize? It is limiting in an amino acid tryptophan. Now, in our body, tryptophan is converted to many hormones and one important vitamin niacin. What is this conversion ratio? 60 mg tryptophan is converted to 1 mg niacin. But if due to any reason tryptophan becomes low, it leads to low niacin in the body, and which will manifest as pellagra, characterized by 4 Ds, diarrhea, dermatitis, dementia, and death. And dermatitis around the neck of a person is Cassell's necklace. So, answer to this question is choice number C, niacin. But please remember another older question from one of the exams. Tryptophan is actually not deficient in maize. It remains in a non-utilized or underutilized form due to excess of another amino acid, that is leucine. So, major culprit is not tryptophan deficiency but excess of leucine. So, leucine is known as pellagrogenic amino acid of India. Question number 18. An Anganwadi worker takes measurement for weight and height of a child. Height for age is less than -2 standard deviation. It signifies. Friends, as discussed in my app video, I have told you that you can see low weight for age as one indicator of malnutrition, low weight for height, or even low height for age. Wasting is when there is low weight for height. This indicates acute malnutrition. Low height for age, this is stunting. It indicates chronic malnutrition. And when we look at lesser weight for age, clinical diagnosis underweight, this actually clinically indicates acute on chronic malnutrition. That means both are present together at the same time in same person's body. Weight changes very fast, acute malnutrition, diarrhea, pneumonia, whereas height change takes a lot of time to change, chronic infection, tuberculosis. So in these cases, if you see height for age is less than -2 standard deviation, so this is definitely stunting, an indicator of chronic malnutrition. A very old question repeated again from the revised National TB Control Program, where pharmacology and PSM subject were integrated. A 25-year-old female patient started on anti-tubercular therapy under RNTCP program. She was currently using combined oral contraceptive pills as a contraceptive method of choice. Doctor advises her to add barrier method as an additional precaution. What is the underlying reason for this particular advice? As you must have read in pharmacology, an important anti-tubercular drug of our program without which we cannot run the program is rifampicin, which leads to induction of cytochrome P450 hepatic microsomal enzymes. And what it will do, it will lead to both estrogen and progesterone's increased metabolism. Increased metabolism means their levels will reduce and their clearance from body will increase. So if estrogen, progesterone hormonal levels are going down, then OCP failure is destined to occur. This is the reason the client is asked to add barrier method as an additional method of protection to prevent contraceptive failure. So answer to this question is choice number D. Rifampicin induces oral contraceptive pills metabolism. Question number 20. A female child has a history of recurrent yeast and respiratory virus infection since the age of 3 months. Immunity status studies are being undertaken. Vaccine contraindicated is. Friends, if you are looking at recurrent yeast and respiratory virus infection since the age of 3 months, plus her immunity status studies are being undertaken, so definitely this is a case of malnourishment. Friends, please remember, several studies have shown categorically that in malnourishment, live vaccines are not contraindicated because of low immunity. Rather, they are more important than a normally nourished child needs. Why? Because malnourished child are more prone to this infection. So in malnourishment, actually, no vaccines are contraindicated in a developing country like India for children. So answer to this question is none of the above. Let me again rephrase it for you. It has been found vaccines work good in healthy children. But in case child is malnourished, vaccines which are immunogenic substances, they work even better because they protect the child from getting those infections. So as compared to a well-nourished child where vaccine is required, for an undernourished, malnourished child, vaccine even becomes more mandatory. So they should not be withheld. DPT, hepatitis B, HIV, measles. Along with that, rabies vaccine, typhoid vaccine, and pneumococcal vaccine have shown that malnourished children respond very well to these vaccines. Only the response of malnourished children is not clear for meningococcal and BCG vaccine. So answer to this question is none of the above. Question 21. International Food Policy Research Institute calculated global hunger index for a country with the following given parameters. They gave proportion of undernourished population 27%, prevalence of underweight children 25%, mortality rate of under 5 29%, infant mortality rate 20%. Question was, which of the following will not be used in calculation of global hunger index? Friends, let's look at this. GHI, Global Hunger Index. What is it exactly? It is a tool which is designed and developed to comprehensively measure hunger, not just at local level, but regional level, national level, as well as international level. When we look at Global Hunger Index 2014, it was based on 3 parameters. Child undernourishment, second, child underweight, and third, child mortality. Child mortality mainly refers to under 5 mortality. But when we look at Global Hunger Index 2016 onwards guidelines, it is now based on 4 parameters. What are these? Undernourishment, then child wasting, which indicates acute malnutrition, we recently discussed, child stunting, which indicates chronic malnutrition, and mortality. So looking at this question, they are asking which of the following will not be used, will be IMR. Infant mortality rate is not used in calculation of global hunger index. Question number 22, 55-year-old man working in a benzene factory for a long time, which he got retired 5 years ago, which could be a possible complication. Friends, in the topic of occupational health, in occupational cancers video in my mobile video lecture app, I told you categorically, please do not get confused between benzene and benzidine nitrogen aniline dyes. When you look at benzidine nitrogen aniline dyes, they lead to bladder cancer. But when we look at benzene, benzol exposure, it is more related to leukemias. So answer to this question is blood cancer. So when we look at benzene exposure as asked categorically in this question, it has been found to be most commonly associated with AML, acute myeloid leukemia, acute lymphocytic leukemia, chronic lymphocytic leukemia, multiple myeloma, and non-Hodgkin's lymphoma also. Question number 23. A 25-year-old woman who has been taking combined oral contraceptive pills give a history of 4 missed pills on different days over last 7 weeks. What is the next line of management? Friends, when we look at guidelines given for oral contraceptive pill usage by Ministry of Health and Family Welfare, Government of India, in case of missing of pills, what are the guidelines? Let's look at them in detail. If the lady is missing one to two pills, first situation, or someone has started the new pack 1 or 2 days late, nothing to worry. Take 1 pill as soon as possible or take 2 pills at the scheduled time. There is almost little or no risk of pregnancy, nothing to worry. Second situation, if the woman has missed 3 or more pills in first or the second week itself, or she has started the new pack 3 days late, then what should be done? Take 1 hormonal pill as soon as possible. Continue with the scheduled pill. Number 3, use barrier methods or some other method for next 7 days. And also, in case there was an unprotected sex in last 72 hours, definitely an emergency contraceptive method could be used. Third situation, if a woman has missed 3 or more pills in third week, in such a situation, take 1 hormonal pill as soon as possible. Finish rest of the hormonal pills. This is as per the schedule. Last 7 non-hormonal pills, that is iron pills, should be thrown away. Start a new pack the next day. 5th, use barrier method or any other method for next 7 days. And 6th, in case unprotected sex in last 72 hours, use emergency contraception. In case someone misses non-hormonal pills, then what do guidelines recommend? Discard the missed non-hormonal pills. Keep on taking the combined oral contraceptive pills once a day. Start the new pack as per the schedule. Also look at the 5th situation, that is in case there is severe vomiting or diarrhea. If she vomits within 2 hours of taking the pill, take another pill. Also, if she has been having diarrhea for more than 2 days or vomiting for more than 2 days, then follow the instructions for 1 or 2 pills missed as discussed in first category or situation. Now look at the question again. The woman has missed 4 pills. So 3 or more pills missed over last 7 days. So this definitely falls in category number 2. So correct answer to this question would be choice number A. Take next pill as soon as possible. consider barrier or other method for next 7 days, and consider emergency contraception if there was any unprotected intercourse in last 72 hours. Question number 24. A patient is a known case of inguinal buboes. He now presents with multiple buboes in axilla and groin. Identify the vector. Friends, which disease are we talking of? Very right. This is disease plague. Causative organism, Yersinia pestis. What is the vector? It is Xenopsilla, rat flea. And which is the most efficient vector of plague species wise? That is Xenopsilla Chiopsis. Typical symptoms of bubonic plague are actually buboes. And what are these buboes? These are large, swollen, tender lymph nodes. Mostly they are seen in neck, axilla and groin. When you look at other symptoms of plague, there may be fever, malaise, headache or blister at the site of rat flea bite. So answer to this question is choice number D. Question number 25. A school going cousin of a 23-year-old woman living in same house contracts varicella. Varicella is chicken pox. Now they are saying the woman was advised varicella antibody test which was found to be negative. What is your best statement? When you look at varicella immunity test, or you can say varicella IgG test, then 3 results are possible. It may come negative, it may come equivocal, or the test result may be positive. Now what is the interpretation? Negative test means no immunity. There was no current or previous infection with varicella. It implies that the person is susceptible to primary infection. Positive result shows immunity. That means person now cannot get chickenpox again, and this immunity could have been acquired naturally through infection or actively through giving the vaccine. Equivocal results are indeterminate results. It is not a foolproof result or indicative of immunity. So answer to this question, this woman is even today susceptible to primary infection or the chickenpox varicella infection. Question 26, again a repeated question. A patient presented with diminishing of vision in low light, that is nyctalopia or night blindness, which is seen in multiple conditions. But look at the other features. Dry eyes, that is, yes, dryness of conjunctiva. Roughening of corneal surface. There is drying and roughening of corneal surface, that is corneal xerosis. So which disease or syndrome we are talking of? Very right, xerophthalmia, which occurs due to deficiency of vitamin A. So answer to this question is choice number C, retinoic acid. So friends, with this we come to the end of this particular session. You must have realized out of 26, minimum 22 questions you should have attempted correctly. Only maybe 1 or 2 mistakes was tolerable. Maximum you should have left 1 or 2 questions out of these which you had no clue about. So I'm sure you have attempted these questions very rightly and correctly in the exam. So from my side, all the best. Before I go, I must say one thing that I sincerely believe in. You must always keep on reminding yourself, no matter how hard it is, or no matter how hard it is going to become in the future, I am going to get it. I am going to tackle all the problems and no one can stop me from achieving the success I deserve. So friends, don't worry, you are going to make it. I wish you all the best from my side. Just have the trust in your own abilities. Thank you. Friends, you can directly download my app from Google Play Store or iOS Play Store, and you can even use the discount code coupon25 for 25% discount. Thank you.